Morning, everyone. Welcome to our COVID-19 weekly media briefing. I'm Kerri Schuette, the Public Information Officer for Shasta County Health and Human Services. I'll start as we always do with our numbers. As of now, we have had 163 confirmed cases since this began, and that is 163 unique people. They are not double counted in the event that they're tested twice. That's a question we've gotten a lot recently. We had 6 confirmed cases yesterday. We've done a total of 14,486 negative tests for a total of 14,649 tests. And that number is the number of tests, not the number of people who have been tested. Some people have been tested more than once. We have 4 people in the hospital. As of our last count, we have 3 Shasta County residents and 1 non-resident, including 3 people in the intensive care unit. We have 32 people in isolation, which are people who have tested positive and are still in their isolation period. We've got 150 in quarantine, and those are people who have been close contacts of the people who have tested positive, and they are quarantined to hopefully avoid spread of the disease in the event that they do develop symptoms. We've had 5 total deaths, including 1 that was announced a couple of days ago. I'll do a round of introductions. We have Mark Mitchelson from Shasta Regional Medical Center, Allison McHugh from Mercy Medical Center Reading, Valerie Lakey from Mayor's Memorial Hospital District, and Jennifer Andrea from Mountain Valley's Medical Centers. On the county side, we have Donnell Ewert. He's the director of the Health and Human Services Agency. Dr. Karen Ramstrom is our health officer, and we also have Dr. Michael Vovakes on the line. He is our Deputy Health Officer for this incident. So we will start with any comments from anybody here who has anything new to share with us.
Sure. I'm happy to start. So good morning, everybody. So, I just wanted to share a little bit about our cases in the recent weeks. I think everybody's really well aware, as Kerri just shared, our numbers have been rising more than we would like to see. And so now more than ever, it's particularly important that we all take care to limit our exposure to others, avoid gatherings, and to practice physical distancing and use of face coverings when we're around others outside of our household and in public spaces. So I thought what I would do to help everyone better understand where those risks are, I can share information on our cases from mid-June. We are working hard to actually have an aggregated way of making this information available in a more systematic way on our website. But I thought I would just share with you my look at our data just this morning. So of about 100 cases since mid-June or so. We shared previously, we've had a couple of gatherings. One was a family gathering of a couple dozen people, resulting in 17 cases. So that included 4 individuals who didn't attend, but then were contacts with individuals who attended that party and got infected, or that gathering. And one of those individuals was hospitalized. There also was a graduation celebration of about 10 or so individuals, and 6 cases resulted from that celebration, including 1 person who didn't attend and was hospitalized. We've also had identified about 10 people who attend the same church. And so we're continuing to kind of look into that to determine whether those individuals all attended a certain church activity, or it's because they know each other and get together outside of church services. We've also had a cluster of individuals of about 5 people associated with an industrial business that we've been investigating and working. We'll be working even more closely with that employer moving forward. It's an industrial business, so not of concern to the public, but we do want to make sure that they have prevention practices in place for their employees. And we've had about half a dozen or so recently who've traveled out of the area for a wedding or a bridal shower, some for work even, and were later told somebody who was at that event was infected, and then these individuals were symptomatic and got tested and were positive. again, so that's about half a dozen people. And we've had a number of people who are household contacts of cases, and that's how they actually acquire the infection. When we identify a case, we give the case instructions on their household to prevent others from getting infected, but oftentimes by the time we hear about it, others have already been exposed. We have about a dozen or so in recent weeks that we can't identify a source, so those would be considered community spread. And we've had 15 or so healthcare workers in the last 2 weeks. The source for those individuals can vary. It could be any of the above that I just mentioned. So we're continuing to monitor that as well. So I think lessons here are that, the prevention guidance that has been put out by the state that we've been working with businesses and other sectors to implement is really important. And so we'll be continuing to do that and promoting those prevention measures that are industry specific. And again, avoiding gatherings, which are particularly prone to spread of COVID-19. So I think that that's all I had this morning, and happy to entertain questions when we're at that stage.
Thank you, Dr. Ramstrom. Anybody else have anything new to share?
This is Allison. The only things that we have is that because of what Dr. Ramstrom just said is one of the reasons why we continue to restrict all of our visitors due to the increased cases in the county. And we continue our daily meetings and communications with our employees regarding our readiness of what we've been working on over the last several months regarding our surge plan, revisiting that every day. Our leaders are out there on the units with the employees, answering questions, being available, making sure they have what they need to continue to be safe.
Thank you. Anybody else?
This is Jennifer. Just a quick update from Mountain Valleys. Every Thursday during the months of July and August, we are offering drive-up testing, rotating every Thursday at our Bernie and Fall River Health Centers. So if folks are interested in East County, they're more than welcome to get tested from 9 to 11.
I've got a few things to share. I just wanted to once again mention the things that the public can do to help with the containing the COVID-19 outbreak. One definition for public health is community organized efforts to prevent disease. And it's different than personal health. We all have our own personal health, and if we have a medical need, we can obtain medical services from our medical provider, go to a hospital if necessary. And, our needs are attended to in that way. Well, with public health, it's an organized effort of the entire community. And when we have a communicable disease, such as the one we're facing now, it does take everyone's participation. Because it isn't only about what I do that affects my health, but what I do affects others' health as well. So I just wanted to go over a few things you can do to do your part to help your own community. And one is definitely stay home if you're sick. So if you even have very mild respiratory symptoms, stay home and stay away from others so that you don't transmit that disease. And of course, there are ways to get tested. We have many different testing options in the community that you can access, and you can look at our website, shastaready.org, for that information. And that is the second thing you can do, even if you're not sick, is get tested. And we do recommend that people who are working out in the community get tested regularly. I personally have an appointment for next week to get tested again, and it is no cost to the individual. There definitely is a cost, but it's been borne by the state of California. But you can go to Shasta College and get tested there. You do need an appointment. You can access the website for that via shastaready.org. Another thing you can do is wear a face covering. And this is very important. And I realize for many people, this is a new experience. It isn't part of our culture, as it is in some other countries, to wear a face mask when you're sick, or, in this particular case, just wear one because we don't know if we're infected or not, because many people with COVID-19 are asymptomatic. But this is a wonderful thing you can do for your community. And it does take some change in our norms. And, I thought for a second I would just talk about how social norms have changed related to tobacco use. And, back in the day, maybe 30, 40 years ago, people smoked everywhere. And they smoked inside, they smoked outside, and generally speaking, they smoked on airplanes. And if you were a non-smoker, well, you breathed the smoke. Then we learned all about secondhand smoke and how it was, detrimental to others' health. And so we started to restrict smoking, and we've gotten to the place now where, of course, smoking is banned in indoor places and even near doorways to buildings. And people who smoke do so outside, and they do so away from others. And so, that happened over a long period of time. What we're asking for is a rapid change in social norms related to face coverings, and with the idea that anytime we go inside a public building, we wear a face covering. And that's why the state has instituted the mandate universal indoor face mask requirement. So if you work indoors or you're going indoors shopping, it is a requirement to wear a face covering, and it isn't akin to the idea that we just don't smoke inside anymore. It's not good for other people. So by not wearing a mask indoors, that also is not good for other people. Remember, we're wearing a mask because we don't know if we are infected, and we're protecting others. So that is the very important thing you can do for your community. And then finally, we really ask people to refrain from gathering with people outside your household. As Dr. Ramstrom mentioned, we've had many outbreaks and individuals who've gotten sick from gathering with others outside their household. And this is being seen all over the state of California. Many counties are reporting very similar types of phenomenon. And so we're seeing transmission in these smaller gatherings in homes and so forth. So if you have a need to visit with someone outside your household, because perhaps you have an elderly relative or something, when you go to visit, wear a face covering and visit outside if possible. And this will greatly diminish the risk of transmission. So those are some of the things you can do for your community to help with the spread of COVID-19.
Thank you, Donnell. Anybody else? Okay, we're ready for media questions.
Well, I've got a couple for Dr. Ramstrom. You had warned us long ago that the number of cases was going to rise, and so it has. But it seems that most of them are not community spread, as you were just saying. A lot of them, and as Donnell was saying, are gatherings. Is that really the more critical thing, to stay away from gatherings?
So gatherings definitely are an issue. But as I said, at least there's some number of our cases that have been acquired in the community. We can't identify a source. And, even when we identify, a person, for example, is a member at a church and their friend got it, we do our best to identify the source, but I didn't even share the total number of 100. So I think it's probably more than a dozen or so that we don't identify the source. The thing is that we're still learning about these cases, because sometimes we learn later from other contacts who give us more information. I do think that you raise a good point that we don't identify all of the cases. That's the thing, is that many of these cases actually were identified because we identified the case and found their contacts and tested their contacts. And if we hadn't done that, then those original cases, sometimes we don't know where they got it actually. And so part of this is skewed because we're identifying more cases among the original cases that we identify. And so I think that there's also a number of individuals out there that we don't ever detect. And that's the concern, is that especially in these indoor environments where we can have close contact with individuals that's kind of out of our control. If we're in shopping and retail, that kind of a thing, that's when we need to take steps to protect ourselves. But the gatherings we know are of concern.
Could you take off your doctor hat or your doctor coat for just a second, and just from a personal level, what's your anxiety level? What should our anxiety level be over this growing number of cases? It's
up there. I'm worried. I'm worried about our community. I'm worried. You know, I think there are a large number of people in our community who are really scared, whether they're older individuals or they have medical conditions. And they are worried when they go out and they're around people who aren't masking, or they get too close to them and they're not comfortable. And I'm concerned that a larger proportion of our community is not engaged in trying to protect each other. That some people don't necessarily think that this is a thing. And it's a thing, it's real. It's we can actually, you know, we have cases identified. We've had an uptick in our hospitalizations, our ICU admissions. I'll tell you, our hospitals can tell you this is a real thing, and we've had deaths. And those family members will tell you this is a real thing. And our 2 cases that we had associated with these gatherings that didn't even attend and ended up in the hospital, that is just completely preventable. That should not have happened. And so, you know, I think we all just need to do better. We just all need to do better and take extra steps. You know, and the other thing that I'll say, just because you said I could just speak, you know, what I want to say is, you know, the guidance is there for a reason. And the point is not to get caught not complying with the guidance. The guidance is there to protect your workers and your customers. And that's really important. You know, if we want our businesses and other sectors to thrive, and we want to protect our healthcare institutions so that they can take care of your family member when they have an MI or a stroke or they're in a car crash, then we all need to actually participate in this and just be careful and physically distance, try and limit our contact with people as much as possible. And if we can't, then wear a face covering. None of these measures are 100% effective, but all of them together is going to make a difference. And the more people that do it, the more likely we're going to be able to have more of a steady level of cases that we can contain. If it keeps going up, we're not going to have the staff or the capacity to be able to do the containment that we're doing now. And we're on the edge of that. And so we're doing our part, and we ask that the community do their part too. And we recognize that some people are, and we thank you and have a lot of gratitude for that. But we're asking that other members of the community engage.
You sound a little frustrated, if not angry.
I'm not angry. It's very, you know, we can only do so much. I think that that's the challenge, and we are working very hard every day, but we can't do it alone. That's the point, is that we need all of you to help us to get this information out. And we recognize some people are able to stay in touch with what's happening more than others. And so if you're talking to a friend or a colleague and they're like, I don't really know. I don't know that there's cases. I don't know that it's an issue. Help them to understand and what they can do. And so I think all of us need to do whatever we can to promote that message.
Thank you, Doctor.
Hello, this is Dr. Vovakes. I would just like to add that I've been asked to look at some of the complaints that we receive in public health, both by email and Facebook Messenger. And these are elderly people who are very concerned when they go to their doctor's offices or their dentist's offices. Sometimes there's signs up saying everybody do social distancing and wear a face mask, where the staff are not wearing face masks, not just clerical staff. Sometimes the physicians themselves are not wearing face masks. We've also had this reported to us by other physicians that offices are not wearing face masks. So it's not just the patients that go there. And these patients and people in our community are very concerned. Most of them have been elderly that have messaged us about this. I've called back these offices. I get a lukewarm response most of the time. So I just, any way that you can publicize that, that the patients out there are concerned when their physicians and clinicians and dentists aren't following guidance to protect them and their own staff.
Thank you, Dr. Vovakes. Looks like Steve has a question.
Yes. When I got tested out at Shasta College, when I made my appointment, I was able to get in within just a few days, and then I got the results within just a couple of days. Now it's taking maybe 2 or 3 weeks to go through the whole process. Is the backup happening at the testing end or at the laboratory end? Is there any way to expand and accelerate that process?
And we're tracking as well. And part of it has to do with not only the supplies for the specimen collection, that seems to be better, but actually the supplies to run the tests. And so the labs, so one piece of it is that the labs where those specimens are sent are actually have some backup because they have an issue with also getting supplies to run the tests. We also think we need more capacity. And so we're actually actively looking at that. We have recently, as Jennifer mentioned, they've graciously, Mountain Valleys has partnered with us to expand our mobile drive-up testing out in East County. And recently Shasta Community Health Center has come on because we recognize that we are limited with what the state testing site can offer. And we're also looking at what we will do should the state no longer support that and how we can actually do that ourselves. And how we might go about even adding a lane if we see a need for that. And so we have seen the same and have the same concern or tracking that in terms of access in a timely manner for the test and then quick turnaround for the test. It's actually a concern statewide, and there's a state testing task force that is actively looking at that as well. The state recently sent out a list of labs for consideration for use for specimens processing, because many of the bigger labs are just backlogged. And so there's a lot of conversation around this, and we're actually in the process of assessing countywide, what is our testing capacity and exploring some new emerging strategies, such as partnering with pharmacies, for example, that can now collect specimens. So we're looking into some of those things.
Thank you. And as an aside, I had heard a lot of that sentiment mentioned by Michael Vovakes about people going to doctors and dentists and other medical related offices and being taken aback at how little precautions were being taken even by the staff. I've heard a lot of that myself.
Right, and I don't know if either Allison or Mark want to comment on that. I think all of us have had challenges with that. And as Donnell mentioned, this is a cultural shift for all of us. Our community includes a spectrum of individuals, which is great. And some have come along faster than others. I do have concerns about our medical facilities and healthcare facilities. These are outpatient practices we've been talking about that are not taken as seriously as we would like. And so we have Dr. Vovakes, as you mentioned, we're continuing to work on that and have some other ideas about how we are hoping to engage those individuals. I would really love to see every healthcare provider in this community model use of face coverings and physical distancing and being careful where we go and who we contact. So that when they go back to their offices, their patients can be assured that that's a safe space to go. And so we're well aware and are working on that.
So for us, I just wanted to say, I can't speak to the clinics for that aspect, but in the hospital, we have seen this virus and what it does to patients and, at its worst. So I think because we've been able to see that, we've been able to, had a little hesitancy from some staff initially when the pandemic started, but because of being exposed to how serious this is, we've been able to have very good compliance and, sometimes putting a little bit of peer pressure on individuals to make sure that they're doing the right thing. But, nowadays we're definitely seeing much better compliance because, we have been exposed to it. We have seen how bad this virus really is.
This is Alice. We also take this very, this is Alice. Also take this very seriously and require all of our employees to wear the masks and actually the eye shields as well. And then because we have our very strict screening process at the front door, that's really that first place when all of our employees come to work, that if they don't have the masks on, then we provide them with one. And that's the same expectation that we have at our clinics.
Okay, I'll try. Kerri, can you hear me this time? Yes, okay. This is Val Mayers, and I just wanted to reiterate what Mercy and Shasta Regional have said. We too have taken this very seriously. All of our staff is very compliant with masking, and all of our clinical staff or anyone that has any type of contact with patient care are actually in N95 masks. And we have also been screening. All of our screening processes started in March, but then I think it was about 3 weeks ago, we have been testing all of our employees. So we will be tested at least once a month. And then the skilled nursing employees and staff that have contact with those residents, it's a little bit even more stringent than that. So it is a very serious thing, and our staff is taking it seriously and doing what we need to do. As Mark mentioned, maybe at first there was a little bit of resistance, but when you see what happens and how you can protect yourself and others, it just makes it a whole lot easier to comply. So we've had good luck with all of that.
I just want to add real quick, Kerri, that, you know, we also know that there's a number of clinics that are doing the right thing and that they are taking this very seriously. And so I don't want to dismiss them. They've taken, you know, great steps to make sure that their staff and that their patients are safe, whether it's in a medical practice or a dental practice, physical therapy office, what have you. There's all kinds of different types of medical facilities. And so we are very, very appreciative and recognize the efforts that takes. And it just goes to show that it's possible. And so we'll just be continuing to plug away and hope to support and encourage other practices to come along.
Thank you, Dr. Ramstrom. Are there any other media questions?
I have a few. So for starters, obviously this past weekend was 4th of July. Are you guys expecting that will lead to an even bigger increase in, you know, cases? Obviously gatherings and travel are a typical, you know, side of that.
We've had that conversation, and so we are waiting to see what happens. We've actually talked about this after other holiday weekends and haven't really seen a big spike. And so we are cautiously optimistic, but we'll wait and see what happens over the next couple of weeks.
Okay. And then let's see here. What was the other thing I was going to ask? Oh, I see. I think we're still at like a level 3, right? For our, you know, threat or whatever. Is at what point would, especially with what we've talked about today, would that go up?
So it could go up if a number of measures. So there's several measures there, and so if any of them go into the red, then that would go up. So whether it's disease status measures, our healthcare system, or ability to control and do containment measures. So if any of those measures go up, then the alert level would go up.
Other questions?
I do. Can you hear me okay?
We can.
Yay. Thank you for answering all these questions so well. I really appreciate it. I have a couple of questions for the hospitals. One is regarding PPE and specifically eye goggles and face shields. I know at Mercy Medical Center, there have been some reports of staff having to purchase their own. And then even with that, some staff members are expected to share it.
Yeah, so
between shifts with other employees. So is there a shortage of things?
Thanks for the question. So no, there's actually not, we don't expect our employees to buy their own. They have an option if they'd like to, if they don't like the types of eyewear that we provide them. We have 2 different types of eyewear that we provide our employees. They're goggles or their face shield. And so they have an option if they would like to purchase their own, but we absolutely have enough supply to provide our employees. What was the second part of the question?
Well, the question I had was, are people expected to share those eye goggles? That's what I'd heard, that some employees are washing them off.
So we have a process that's called, that everyone is familiar with, that if we were to get to a point in order to preserve our equipment, that's a process of reusing and cleaning equipment. So it's not a mandatory process. It's a preservation effort that at certain points, if we were to need to ask them to clean them in between, that's a pretty common procedure that's done with guidance from our infection control team.
According to some of the people I've spoken with, that is happening now. They're actually sharing it between staff and between shifts.
Mm-hmm. Yeah, I can't speak to that. Our expectation is that we do ask them to preserve, because if we ever were to get a surge, then we know that we would, probably be like many places and not have that. And so a proactive approach is to comply with infectious disease cleaning protocols and use certain specific equipment for their entire shift. And if they're working, several days in a row, then they would, wear that same equipment again. So I'm very confident in the processes that we use and that they're doing, that they're describing with you.
Other media questions?
Yeah, and I had another question for the hospitals about the number of infected staff members at each hospital.
No, all I can say is no changes from last week, from what I stated last week.
Okay, any other media questions?
And don't shoot me, but I have one more question about the Bernie drive-through testing site. So can anyone?
Yes, it's open to the public, and they just have to call down here at Shasta County at the Shasta College number, and it's listed on our website and all our social media outlets. They can call and request East County testing, and it's that easy, and it's from 9 to 11.
And that is, Jennifer, that's for people with and without symptoms.
Correct.
Thank you.
Thank you
Sonny?
so much. Thank you so much.
Sure, okay. All right, so we're already a little bit past our time, but we did tell our Facebook Live viewers that we would answer a couple of public questions. So some of these we'll have to answer offline, but I'll do my best to whiz through as many of these as we can. The first one, I don't know that we can answer this. We take patient privacy extremely seriously, but there are folks, and we get this question a lot, wondering if the people who have died of COVID here, if they had underlying conditions. Dr. Ramstrom, is that something that we can answer?
So it's not something we can answer on an individual basis. Sadly, as our number of deaths go up, we may be able to, or considering, what kind of aggregate information we can provide.
All right, thank you. There's a question about weddings in Shasta County, and we are just finishing up guidance about weddings that we'll be reviewing and posting soon, so stand by on more information about weddings. There's a question about the CDC stating the numbers no longer constitute a pandemic. And so why are we continuing to alarm people as if the pandemic has worsened when in reality the numbers are going testing? but there is no dramatic increase in deaths caused specifically by COVID. I can address that one offline. Project Home Key is another one that requires probably more explanation than we have time for here, but we will be sharing more about that. Somebody asked about the local hospitals already. The 5th patient who died, was that person a Shasta County resident? If they were counted in our numbers, then they were a Shasta County resident. Yes, that's how we count numbers, is people who live here in Shasta County. How close is Shasta County to being on the watch list?
So we are watching that every single day. We have there's some latitude because we have a lower population than some of the other larger counties that are on the list. And so right now, the measure that is most concerning, thankfully moving in the right direction, is our number of ICU beds. And but other than that, we seem to be looking okay. But if we don't continue to try and improve our prevention practices, it's not out of the possibility that we could get on that list. And so that's part of why we are really encouraging engagement of individuals to help their community, as Donnell explained.
Thank you, Dr. Ramstrom. There are lots and lots and lots of questions about the schools, and we want to acknowledge that we're getting lots of questions about the schools. Dr. Ramstrom and Judy Flores, our superintendent of schools, have been working very hard and lots of hours with the various school personnel to figure out some long-term plans. And we don't have time to address that in this forum, but I think we need to find perhaps another day and time that we could actually talk just about the schools, because clearly it's very important to us, and it's also very important to all the parents out there who are wondering what's going to happen with schools. So more information to come on that very soon. And then we'll do one more, and this last question is one that I've answered a lot of times, but clearly I'm not doing a very good job. So I'm going to have Dr. Ramstrom address it once and for all, because she does it so much better than I do. Why aren't you notifying the public about patients' whereabouts in the days leading up to their diagnosis like you did with the measles? It has been shown that COVID-19 is present in the air for hours, just like the measles, and our community has no immunity. Please address.
So there's, I guess, several parts to the answer to that question. So and we understand the concern and why people are asking that question. And recently, I'm sure people have seen in the media that there has been a call by a group of scientists to the World Health Organization encouraging them to acknowledge that there is some evidence about airborne transmission in certain types of situations and certain types of activities, for example, where either people are singing or breathing heavily with exertion and enclosed spaces. And so the World Health Organization has just acknowledged that they recognize that, and that they're tracking and continuing to look at the science in terms of this spectrum of, we think most of this type of transmission is droplet, meaning it's within that, immediate space of a person. But in certain types of activities and certain types of enclosed spaces that have poor ventilation, maybe there is a little bit of airborne transmission. So that's something that we're continuing to look at and learn about, because this is a new virus. And so because we know that most of this transmission is droplet, that's generally what our focus has been in terms of prevention messages. But when our nurses do case investigation, they ask the person about where they've been and try and get at where transmission might have occurred. And then we actually notify individuals specifically who could have been exposed. And so if we were to learn that in certain situations, say there was a specific kind of incident where we were worried there could have been activities that might have involved airborne transmission, we could consider that differently and notify the public. We haven't had any of those kinds of situations as of yet.
Kerri, I want to take a run at that previous question that you read, just because you read it. Because it's fake news, we don't have a pandemic. And I just feel like, you know, if someone's going to say we don't have a pandemic, I've got to respond to that. An epidemic is more cases of a disease than expected. And since this is a novel virus that just emerged in December of last year, obviously we didn't expect any cases in 2020. And we've got more than 150. So it's an epidemic. And then a pandemic is an epidemic that's everywhere. And COVID-19 is an epidemic that is affecting every part of the world. So that's why it's a pandemic. It has not gone away. It doesn't benefit us one bit to pretend that something isn't happening. That makes matters worse. We'd have to address it. And I think that behind the scenes, there's so much going on that people can't see. We have a very aggressive containment activity going on every single day, 7 days a week in this community. And if our numbers are lower than some places, it's because of all the work that's being done in our laboratory and by our nurses and by our contact tracers and people calling people in quarantine. We have approximately 200 people in quarantine right now. That does not happen simply. There's a lot of work that goes into that, and that is what is protecting our community. We are isolating those known cases and people who are known to be exposed and trying to limit spread. And unfortunately, we can only do that for the cases that are reported, that we identify. We can't do it if we don't know about cases. So there's still some cases that circulate in the community that we don't know about, and that's where community spread comes from. So we do have a pandemic. We still have a health emergency.
Thank you very much for that explanation. Does anybody else have any questions, comments? No, hearing none. Thank you to all of you on our panel. I know we said 11:30 was the time that we stopped. I appreciate you helping to answer those questions so that some of our public can be heard and answered. We will see you all again next Wednesday at 11 a.m. Everybody have a great rest of your day.
Thank you.